So a couple of these articles you're probably pretty well aware of, but I'm just going to flip through them really quick. This first one is from Dr. Whitfield. It really does just tell us basically that for the last 20 years, pressure ulcer incidence really hasn't changed. It's about 7%, up or down a percent here or there, but over 20 years it really hasn't changed much. And I will tell you, being a nurse for 26 years now, we've been working on skin care and skin care prevention, or pressure ulcer prevention, for a long time, and really haven't made much dent in this pressure ulcer incidents across the country. Another article is actually from one of our mentor hospitals, OSF Hospital in Illinois, and they've done some great work in pressure ulcer reduction in their hospital. And in this particular article, they actually walk you through the steps of how they've done what they've done. They did a Six Sigma project, and they've documented it very well, and it's got some great tips and tricks in it for you. This next study really tells us basically it matters what you eat. It matters what our patients eat, and we'll talk about that a little bit later, but we really have to focus on that so that patients are able to have good skin, have good nutrition and good hydration to keep their skin safe. Another article, this basically tells us it matters what you lay on. You know, putting folks on hard ER stretchers for 4, 5, 6 hours at a time is not good, and low air loss mattresses and beds really does help us save our patient's skin. This last article is a review of articles for about 20 years of articles, and it basically tells us risk is predictable, skin can deteriorate in just a matter of hours, wet skin is more vulnerable than dry skin, and those of you who are parents know that very well. We learned very early on when our kids were born that wet bottoms don't do as good as dry bottoms. Continual pressure, especially over bony prominences, can increase the risk for our patient's skin. And pressure relieving surfaces really can help our folks.